In this video I'm going to show you how to treat and prevent active acne. In our clinic we have the N-Light laser to heal any infected acne spots. However, the N-Light laser does not prevent acne from occurring. What you do need to use is you need to do a course of professional skin peels to help prevent your acne and to prevent and treat blackheads. Now, the professional chemical peels that we do in our clinic are known as the Radient peels. These are primarily salicylic acid based peels. It's a 30% professional peel. Now, this course of 5 peels that we recommend every fortnight works very well, however it does not work on its own. You must use a 2% salicylic acid product at home. This is the Alumier Acne Balancing Serum. It contains 2% salicylic acid and also has a hydrating element of hyaluronic acid. This must be used daily, once to twice daily, depending on how severe your acne is. It must be used daily because we shed millions of skin cells every single minute of the day. And if you allow those dead skin cells to build up, it'll trap the oils in the pores and block them. So that's why your daily home care is absolutely essential for results. So stay tuned and watch the professional skin peel from Alumier. I'm going to do the Radiant 2010 peel. This is for acne, so this client here has back acne, so I'm starting with the balancing solution to prep the skin. So this is the Radiant 2010, 20% salicylic acid, 10% lactic acid. This peel can be left on the skin for up to 20 minutes. Depends, 10 to 20 minutes, depends on the tolerance level of the client. This purges the skin, it helps to draw all impurities, blackheads, blocked pores, all up to the surface. This peel can be done on the face and the chest as well if you've acne there. A course of 6 of these peels, spaced out a fortnight apart, is fantastic for deep cleansing the pores and preventing acne. So now the peel has been on 20 minutes. I'm going to neutralise it now with an alkaline spray. This will feel a little cool, okay? Continuing the neutralising process with alkaline soaked cotton pads. The skin is dried off before the treatment serums are applied. So the next process is to put some brightening accelerator on. This will help to lighten any pigmentation marks. It's very common to have hyperpigmentation, little brown spots when you have acne. It's just part of the healing process when the skin overpigmentates, so that's why we use a brightening serum. Then we put on some vitamin A serum. This will tingle the skin a little bit because it has some peeling agents. So that just enhances the overall peel. And we finish off with some recovery balm to soothe the skin because the skin might be dry. It's a nice rich cream to help. There's shea butter in it to help to soothe the skin. And that finishes our acne peel.